Hi, my name is Mercy John. I'm a student, a family nurse practitioner student with UT Arlington. I have to do a head-to-toe assessment on you.
Okay.
So let me go ahead and wash my hands. Can you tell me your name and your date of birth?
My name is A.V. John. My date of birth is May 2073.
Where are you right now?
I'm at home.
Can you tell me today's date, the day, and the time?
Today is 26 October 2016, 10:15 p.m.
What is your mood now?
I'm okay now.
Okay, Mr. John, he is 43 years old, male. Uh, he is alert oriented to time, place, and person. His uh, his mood is good, and his dressing is appropriate according to the setting. Okay. When on inspection of the skin, I note there is no lesions, um, uh, there is no color change, no edema noted, and the color is normal, temperature is normal, uh, and on checking the on palpating the skin for skin turgor. Okay, there is intact. The skin has intact recoil. Can you show me your fingers, spread your nails? The nails are well groomed. There are no lesions, no edema, no pitting, no edema seen, and the nail beds. The nail adhere to the nail beds, and it is at 160 degree. On checking the capillary refill, it is less than 2 seconds. Okay. And inspecting the hair and the scalp, the hair is evenly distributed, and there is no scarring, no inflammation. On palpating the hair and the scalp, do you have any pain here?
No.
Okay, there is no lesions, no masses, no scarring, and no area of tenderness. Inspecting the head, neck, and the lymph nodes, the head is normal, round and non-cephalic. Facial features are symmetrical, and the neck, there is no thyromegaly, and palpating the trachea is midline, and auscultating the thyroid and also palpating the thyroid. Okay, can you swallow for me? Can you turn to the left and swallow? Can you turn to the right and swallow? Okay, on palpating the thyroid cartilages rises on swallowing. There is no mass and no nodules. Auscultating for the carotid pulses or bilaterally. There are no bruits heard. Palpating for the nodes bilaterally. Starting with the occipital. Do you have any pain here?
No.
Pre-auricular, post-auricular, tonsils, submandibular, submental, anterior cervical chain, posterior cervical chain, superior clavicular lymph nodes, axillary, bilateral, epitrochlear. Any of these palpated lymph nodes, do you have any pain?
No.
Okay, so all the lymph nodes that has been palpated is non-palpable and non-tender. Coming to the eyes of inspection, the eyebrows are evenly distributed over each eye. Eyelashes are evenly distributed over each eye. Eyelids are symmetrical and no ptosis noted. The sclera is white, conjunctiva is clear. The iris is brown bilaterally. Okay, can you close your eyes? Let me check for your eyeballs. Do you have any pain here?
No.
Okay, open your eyes. The eyeballs are intact and firm. non-tender, no nodules, no mass noted, and the lacrimal apparatus is soft and no exudates. Okay, we have two charts. First is distance vision, and second is a near vision. The distance vision is checked by the Snellen chart. In this, the patient covers one of the eye, and the chart is at a distance of 20 feet. And the patient is asked to read the smallest line possible with all the letters, and do the same thing with the other eye covered. So the numerator is the distance from the chart, and the denominator is the distance an average eye can read. And near vision is checked by a Rosenbaum chart. In this also the patient is asked to cover one eye and read the smallest line possible with the other eye, and same thing, cover the other eye and read the smallest um, line possible with the uncovered eye. So next I'm going to check the inner inside of your eye with the ophthalmoscope. Okay, and, the number that I choose is 9. I had to look in the patient's right eye with my right eye. Now bracing at the bracing, upper lid up, follow the right lid, reflex inside. Same thing, the left eye with the patient's left eye with my left eye. Okay, the optic disc has no nicks, and no, it's round, and no hemorrhages are seen. And checking the pupils for accommodation. Okay, follow this light as I bring closer towards you. The pupils accommodate and constrict as the patient follows the pen light that is brought near to the patient. Checking the direct and the consensual. When the light is shined into the right, when the light is shined into the right eye, the left pupil constricts. And when the light is shined into the left eye, the right pupil constrict. For checking for the corneal light, when the light is shined on the bridge of the nose, the light shines on the pupil. Checking for doing the cover and the uncover test. Can you cover your left eye? No nystagmus noted in the right eye. Can you cover your right eye? No nystagmus noted in the left eye. Okay, checking for the 6 extraocular movements. Look at when I shine the light, you need to look at here without moving your head. Move only your eyes when I move into the 6 cardinal points. The pupils are round and reacting, and the pupils follow the 6 cardinal regions of the gaze. Okay, now the ears are symmetrical inspection of the ears are symmetrical, and the pinna is in line with the outer canthus of the eye. And on palpation, the pinna and the masseter pole. Do you have any pain here?
No.
It's non-tender, and no mass and no nodules noted. Now I have to check the ear canal and the tympanic membrane. For that, I have to use the otoscope. On checking looking through the otoscope into the ear canal, there are no exudates, no erythema, and no foreign body, no discharges in the ear canal. The right side tympanic membrane is pearly gray, and the cone of light is at 5 o'clock. And on the left ear canal, there are no exudates, no drainage, and no foreign body. And the left ear tympanic membrane is intact and pearly gray, and the cone of light is at 7 o'clock. Next comes the whisper test. Mr. John, I want you to close your right ear and wiggle it, and so I'll tell a word, whisper a word, and then you have to repeat the same word. Okay? Now close your right ear.
Ice cream.
Okay. Do the same with your left ear.
Pineapple.
Coming on inspecting the nose, nose, mouth, and the throat and the sinuses. The nose is in midline, and the septum is not deviated. Okay, can you close one of the nostril and breathe through the other? Okay, and do the same with the other nostril. Okay, both the nostrils both the nostrils are checked for patency, and they are patent. Okay. I have to look in the inside of the nose. Okay, bracing. On otoscopy, on the inside of the nose, the terminates are pink and moist. There are no polyps noted. The lips are symmetrical. The lips are symmetrical, pink, and no lesions noted. Can you open your mouth for me? I just want to count the number of teeth. Okay, the gums are moist and no lesions noted. The teeth is 32 in number, no dental caries noted. And the buccal mucosa is moist and no masses or no lesions noted. Can you lift the tongue for me? Okay, the tongue is, the frenulum is intact. Tongue is pink, moist, and symmetrical. Okay, can you say R for me? Ah. Okay. Tonsils are 1 plus, no exudate, uvulized midline, and rises with phonation, and pharynx is pink. Okay, can you take a tissue? On inspection, the chest is even, the skin is even and symmetrical. No overly ribs is prominent. The breathing is 18 breaths per minute, and yeah, breathing is even and unlabored, and no accessory use of the muscle. And next is percussion from the posterior side. One, two, three. Okay. Raise your hands up. Put your hands down. On percussion of the chest, um, the tympanic percussion is over the ribs, heart, and the diaphragm, and resonance is over the peripheral lung fields. And then next is auscultation, starting with the posterior. Okay, open your mouth and take a deep breath for me. Okay, raise your arm. Yeah, put your hand down. On auscultation of the chest, over the trachea, bronchial sounds are heard, and expiration is greater than inspiration. Under the clavicle, bronchiovesical sounds are heard, expiration is equal to inspiration, and over the lung fields, vesicular sounds are heard where inspiration is greater than expiration. Okay, can you lie down? Okay. Okay, the heart is inspected. There is no thrust or heaves. Palpate the precordium. No thrills can be heard. An apical pulse for 1 minute. I can sit up. Okay, listening to the heart sounds. Aortic on the second intercostal space, right sternal border, S2 is greater than S1. Pulmonic, second intercostal space, right sternal, left sternal border, S2 is greater than S1. Erb's point, third intercostal space, S2 is equal to S1. Left sternal border, tricuspid, fourth intercostal space, S1 is greater than S2 for left sternal border, mitral, mid-clavicular light, fifth intercostal space, uh, yeah, S2 is greater than S1 is greater than S2, and check for the apical pulse for 1 minute, which is 80 breaths per minute, and the rate and rhythm is regular. Okay. Can you um, lie down? I want to. Okay. Next, I have to check for the blood vessels. Palpate the blood vessels. Temporal palpated bilaterally. Brachial palpated bilaterally. Radial palpated bilaterally. And dorsalis pedis palpated bilaterally, and the posterior tibial palpated bilaterally. They are +2 and palpable. Okay, can you lie down? I want on. Okay, move up. Move down. Okay, on inspection of the abdomen, it appear in line with the abdomen. The abdomen is looks is symmetrical. The contour is flat. Color is consistent with the rest of the body. And there is no masses, seen, no obvious distension seen. Auscultation of the abdomen in the 4 quadrants of the abdomen. On auscultating, there is 5 to 35 times bowel sounds heard per 35 times bowel sounds heard per minute. And with the bell of the stethoscope, here the auscultate the epigastric region, no venous hum. Percuss the 4 quadrants of the abdomen. Okay, the tympani is heard over the air-filled organs like stomach and intestine, and dullness is heard over the solid organs like liver and spleen. Palpating for the liver, percussing for the liver, and measuring the liver span. From the area of the tympani to the right mid-clavicular line, where the sound changes to the dullness. That's the lower border of the liver. Mark that area, and from the area of resonance down to the right midclavicular line, down to the right midclavicular line, where the sound changes to a dullness. That's the point of the upper border of the liver. To measure the averages between the fifth and the seventh intercostal space. Now measure both these points. This is usually between 6 to 12 centimeter, but for this patient is 7.5 centimeter. Okay, check for the while doing the for measure, palpating for the spleen with the deep palpation. Usually the spleen bumps into the examiner's hand on when patient takes inspiration. Light palpation in all the four quadrants of the abdomen. The abdomen is smooth and soft, and deep palpation on all the four quadrants of the abdomen. There is no masses. There is no masser, and that area is not tender. Usually, the tenderness can be felt on the region of cecum, sigmoid colon, and sigmoid process. Can you sit up, please? Checking for the costovertebral angle tenderness. Do you have any pain here?
No.
Do you have any pain here?
No.
Okay. Because there is no costovertebral tenderness noted. Okay, can you stand up, please? And can you walk? Okay. Sorry. Can you sit? Mr. John's gait and the posture is normal, even as symmetrical. I want to see look for the scoliosis. Can you stand here and bend to the toes? Okay. There is no rib hump seen. The shoulder, hip, and scapula is even, so scoliosis screening is negative. Checking for the active and the passive range of motion. Okay, can you dorsiflex the ankle? Can you plantarflex the ankle? Can you internally rotate and externally rotate? Okay, passive range of motion, dorsiflex, plantarflex, internally rotate, externally rotate. Okay, cervical flexion. Can you bring your chin to the chest, hyperextend, bring the chin to the left shoulder, bring the chin to the right shoulder, turn your ear to the left shoulder, turn your ear to the right shoulder. Okay, passive range of motion. Okay. Can you flex and extend your elbow? The other hand. Passive range of motion. Okay. Can you bring your fingers down like this? And up and hyperextend. Okay. Now with the thumb, touch the tip of each finger. tip of each finger with the other. Okay, with the thumb to the base of the little finger. This. Okay, and relax. Now make a fist with this hand. Fist. Okay, fist. Relax. With this hand and relax. Take your hand, move your hand up and put your wrist down and up and hyperextend and okay and relax. Okay, passive range of motion. Okay, okay, move your fingers apart and bring it closer and relax. Okay, yeah. Can you lie down? Okay. Can you raise your leg up? Okay. Can you raise the other leg up? This leg should be up and relax. Passive range of motion. Okay. Can you lie down on your stomach, please? Can you bring this leg back and relax? Can you bring the other leg back and relax? Passive range of motion. Okay, come back, please. Okay. Can you bend this knee and relax? Can you bend that knee and relax? Passive range of motion. Okay. Can you bring this knee to the chest? To the, yeah, try to. Okay, and relax. Can you bring the right knee to the chest and relax? Passive range of motion. Okay, can you swing the right leg out of your body? Swing it, bring it, and relax. And do the same with the other leg and relax. Okay. Passive range of motion. Can you bring the right ankle to the left knee and relax? Left ankle to the right knee and relax. Passive range of motion. Okay, can you stand up? I want to see the knee flexion. Stand up. Okay, can you bring your knees back? Okay, relax. And bring it forward. And then relax. Passive range of motion. Okay, lift it up. And relax. Okay, I want to check the range of motion of your shoulder. Can you please sit? Raise your arms above over your body and bring it back here. Okay, and raise now swing your relax. Swing your right hand across the body. Swing your left and relax. Swing your left hand across the body and relax. Bring your hands behind your hips and relax. And bring your hands behind your head and relax. Okay, coming to the neuro. Cranial nerve 2 is the optic nerve, and that is sensory, and that is intact, as evidenced by the distance checking the vision test. Cranial nerve of 5, which is trigeminal, is sensory and motor, and that is checked by testing the deep and the dull and the sharp sensation. Okay, can you clench your teeth? Palpate the joint. It's normal. Okay, Mr. John, can you show me a hand? Okay, I'm going to put this, prick this way in your face. So you have to distinguish between sharp. This is sharp and this is dull. And you need to let me know when do you feel sharp and then when you feel dull. Okay, can you close your eyes?
Sharp, sharp, sharp.
Okay, now open your eyes. So the trigeminal nerve is intact. And next is the facial nerve. Facial nerve is the seventh nerve, and it's sensory and motor. So facial nerve is checked by, can you raise your eyebrows up and wrinkle your forehead and smile, but don't show me your teeth. Okay, now show me your teeth. Puff out a cheek. Okay, and can you differentiate between salty and sweet?
Yes.
So the facial nerve, seventh facial nerve is also intact. Cranial nerve number 8 is vestibular cochlear, which is sensory, and that is intact as evidenced by the whisper test. Cranial nerve 9 and 10 is sensory and motor, which is glossopharyngeal, and vagus nerve is intact, as we have seen the uvula rise with phonation, then the patient swallowed, and there is gag reflex. And can you differentiate between sour and bitter?
Mm-hmm.
Okay, so that nerve is also intact. Cranial nerve 11 is spinal accessory, which is motor. And okay, can you shrug your shoulder? Okay, push through my resistance. Okay, relax. And also, okay, tilt your head this way on the tilt it. Okay, push through my resistance. Okay, and tilt this way and push through. Yeah. So in this we see that there is strong contraction of the trapezius and the sternocleidomastoid muscle. So that is also intact. The cranial nerve number 12, hypoglossal, is motor. Can you stick out your tongue back and forth, lateral side, and push through your cheek and through my resistance? And okay, so when we check for the hypoglossal bilaterally, it is also intact. Now we need to check the deep tendon reflex. First is the biceps. The elbows are placed at 45 degree, and the bicep tendon is strike the biceps tendon, and you can see an extension, flexion to the elbow. Similarly, on the right arm, and you can see an extension to the elbow. The brachioradialis tendon is tested. Okay, and the brachioradialis tendon is the strike the brachioradialis tendon, and the elbow, there will be flexion in the elbow. Similarly, on the other hand too. Next comes the tricep muscle. Okay, hang the elbow this way, and strike at on the tricep tendon on the back of the elbow. You can see an elbow extension. Similarly with the left arm, There will be elbow extension. Checking for the patellar reflex. Strike on the patellar tendon. There will be movement. There will be extension of the lower extremities. Similarly, on the left leg, strike on the patellar reflex tendon, and there will be movement of the lower extremities. Next is testing the Achilles tendon. Hold the heel, support the heel, and then strike on the Achilles tendon. There will be plantar flexion of the foot. Similarly, on the left leg, hold the heel and strike the Achilles tendon. There will be plantar flexion of the foot. Plantar reflex. Stroke from the heel of the foot from the medial surface to the lateral side. There will be plantar flexion of the toes and the plantar flexion with fanning of the toes. On the left foot on the stroke from the heel to the medial surface to the lateral side, and there will be fanning of the toes. Okay, some of the Okay, can you lie down? I have to do some of the special tests. Like the first one is anterior. Okay, first one is anterior drawer test. Come on, come on. You have to sit on the foot. Place the finger behind the calf and the thumb on the tibial plateau, and give a firm anterior pull on the tibia. We should check for the laxity if it is more than 6 to 8 millimeter. Check on the other foot also. Do the anterior guard test on the right foot. Next is the Murphy sign. Can you go up? Okay, Murphy sign. Do a deep palpation under the costal margin, and if the patient's gallbladder is inflamed, then the patient will hold the inspiration because of the pain. But right now the patient has no pain, so Murphy sign is negative. Okay, can you sit up? Checking for the Weber and the Rennie test. Okay, when I strike the vibrating fork and I put it the base on the skull, you need to tell me if you can hear the vibration in both the ears. Okay.
Yes.
That means the patient can hear the vibration in both the ears. Rennie test is I'm vibrating and I put the base on the bone, and when you stop hearing the vibration you should let me know, and at the same time I'll bring it forward before your ear, and if you stop hearing the vibration you need to let me know.
Stop. Stop.
So in this, the air conduction is twice longer than the bone conduction. Now is the Tactile parameters. Checking for the tactile parameters. Okay, repeat 99 with me. Okay, keep on saying 99.
99, 99, 99, 99,
Check on the anterior thorax. Repeat the same thing.
99, 99, 99.
Okay, tactile parameters is the same. The vibration is the same. Check for the maxillary transillumination. Okay, so the light is shined to the lateral side of the nose and beneath the middle aspect of the eye. Can you open your mouth and look uh, for the palate? Okay. In the neuro, there was a coordination test. So, can you uh, pat your hands on the knees faster and faster? Okay. And the coordination is okay now. And also, you have to extend your hands and with the alternate hands, close your eyes and bring the tip of the hand to the tip of the nose faster and faster. So this shows the rhythmic movement is normal. Now checking for the sensation on both the extremities and also the vibratory sensation. Okay, I'll be doing the I'll be checking the sensation with the sharp and then dull and soft and touching in any part of your body with your eye closed, and you have to let me know where you feel it and is it soft or dull or sharp. Okay, come on, close your eyes.
Sharp right hand, sharp left hand, soft left leg, sharp right leg,
Okay, open your eyes. Next, I have to check for the vibratory sensation. Okay, now you need to let me know where do you feel the vibration, in which body prominences. Okay, close your eyes.
right leg, left hand, right hand,
Now, lastly, I need to check for the Romberg test. Can you stand here? Okay, I'll just push you, and the patient appears he's normal and he has no gait or posture problem.